The Immunotherapy Scam. One technology which has become extremely popular in IVF clinics today, especially for patients who have repeated IVF failures, is called immunotherapy. Now, repeated IVF failures are a frustrating problem, but the reality is that in India, the commonest cause for repeated IVF failure is a bad IVF clinic who are putting poor quality embryos back, which are never going to implant. But doctors don't tell patients the truth. They hide this information. They don't give them embryo photos. They put embryos back on day 2 or 3 where they don't belong. And then when these patients fail cycle after cycle, they come back to the doctor and are extremely unhappy. And the doctor says, don't worry. Let's use some new technological innovation. Let's do PRP injections. Let's do PGD. Let's do error tests. And now the newest test which they do is called immune therapy. Sounds exciting. No one understands anything about the immune system, and trust me, IVF doctors understand very little. But it's very seductive as a concept. What did they tell the patient? Because it's very easy to sell these patients on anything at all. Patients are desperate. We put a top quality embryo back inside your endometrium and it didn't implant. One possibility is your body is rejecting that embryo. The immune system in your uterus isn't working properly, and because it's rejecting the embryo, that's why the embryo is not implanted. What does a poor patient understand? Makes sense. After all, we know that you can reject a kidney, so maybe you can reject an embryo. What they do not realize is the uterus is an immunologically privileged site. The uterus can accept embryos from anyone and everyone, and that's common sense because don't forget 50% of the genes of an embryo come from the husband, which are foreign genes. There is no such thing as immune rejection, but patients don't know any better, doctors won't tell them the truth, and then they have this long list of fancy treatments available, starting all the way with steroid therapy, which is relatively simple and not very risky, all the way to what is called lymphocyte immune therapy or intravenous immunoglobulins. These are expensive and complete rubbish and are actually risky, but patients are desperate once they fail 2 or 3 cycles. And this is a particularly common problem when they fail 2 IVF cycles in one clinic and then go to a new clinic, because the new clinic obviously wants to do something new, something different, something expensive. They have to show the patient, hey, we're better than the old doctor. And this is how doctors take patients for a ride, which is such a tragedy.